kick us off.
All right, I'm so excited to be here today. Happy Weekly Wellness. Today, we're going to be talking about some of the tests that either we have added as standard tests in FLI because we realize the importance of them, or a test that we're going to offer for those of you who would find it useful and helpful. So this is going to be a discussion just about a few tests, and then also wanted to point out that at 6 months, we do a follow-up testing protocol as well. So when you came in, you got your initial test done. It's a huge battery of tests. And depending on what your results were, what your health issues are, what your concerns are, what we saw through the CGM or through sleep data, we might decide to do certain tests at 6 months. So everyone will get a retest at 6 months, and that will be really personalized. Some tests we're going to just do for everyone, but a lot of them will be based on what you need. And some of them, if everything's perfect and you have no complaints, there's no reason to redo them. Whereas other tests, we really want to make sure that you're improving like we're hoping. So that will be the 6 month tests. And if you have any questions specifically when your 6 months comes up about what tests you want or something you're concerned about, we can definitely talk about that ahead of time. And just briefly, I want to mention something that we recently included called the VO2 Max. You've probably all heard about it. We've been, letting you know that this is available now. It is a test that looks at how your body utilizes oxygen. And it's done at Custom Fit, which is the same place that if you're local, you got your DEXA scan done. If you're not local, we can set you up to come in and do several things all at the same time. And the test either puts you on a bicycle or a treadmill. It puts this contraption on your face with a mask that measures your oxygen and CO2, and it has you run or bike at your highest capacity, and you stay at that highest capacity for at least a minute so they can measure everything. Where your VO2 max is very correlated to your health span and your longevity. It's a really important metric, and it's something you can improve. So Emily, our fitness trainer, will be the one who is reviewing that with you and give you interventions and exercises and a stepwise approach so that you can improve that VO2 max. Anything else, Lynn or Celeste or Dana, that you want to add to that? It's not my area of expertise.
Yeah, so we test VO2 max because it's one of the strongest predictors for longevity and lifespan. So it's a really good biometric measure of your cardiopulmonary fitness. So outside of just the standard lab work and things that we can detect from drawing your blood and things like that, the VO2 max is actually telling us what your cardiopulmonary fitness is like, and it's actually a movable needle. So it's not just a test to test something. It's really important for baseline and serial monitoring so that we can see how improvements are happening for that longevity bit.
So if you have not got it done yet, we really encourage you to do it because it is an important metric. It is included in FLI, so it's part of your membership. And the sooner you get that done, the more Emily will be able to help you during this year of membership and beyond to improve that. Okay, moving on. Any questions from any of our members about that? It's good to see you all here. No questions? Okay. So the next test I want to talk to you about that we've added on is we've added 3 new tests that are all related to the same thing. So it's oxidative stress, and we've added on an LDL ox test that is part of your blood panel. And we've also added something called the Genova Ox 2.0, and that's testing 2 markers of oxidative stress, your lipid peroxidase and your OA-HDG, and it's also testing glutathione, which is an antioxidant, kind of your master antioxidant in your body. What I would love to start with is explaining what is oxidative stress. I am sure many of you have heard that term. You know it's something that's bad, that we don't want, and that it can cause damage, but to understand exactly what that is and to kind of visualize it. So this will be a really simple explanation. I am not a biochemist. But I do understand how this works in our body. So oxidative stress, if you all remember back to high school or college biology and you have an atom, in those atoms, you have electrons going around the outer rim of the nucleus, and those electrons are a negative charge. And things in our body want to be in homeostasis. It wants to be balanced. You want to have a cell that doesn't have an excess negative charge. So when you have different processes in your body, whether it's creating ATP, whether it's having an infection, having inflammation, eating foods like sugar or unhealthy fats, all these things can cause oxidative stress, is when you have an imbalanced atom and you have like this lost electron. And so this cell desperately wants another electron to feel balanced. And it's completely out of sorts. And it is frantically bouncing around your body to try to find that extra electron. So antioxidants, so we know, right, berries and leafy greens and supplements that are antioxidants, vitamin C, what that antioxidant does, it has that extra electron to give to these cells so the cell can calm down. So when we don't have enough antioxidants in our body, whether that we make ourselves or that we ingest, these free radicals, these cells that need an extra electron, are bouncing around like crazy. And they're actually causing physical damage in your body. It can damage your arteries in your heart, which is what can lead to atherosclerosis. It can damage your DNA. It can damage your fat molecules in your body. It can cause damage in your brain and lead to cognitive issues in the future. So very simple explanation is this: oxidative stress is something that can cause problems to our health span in many different ways and in many different systems. And there's a lot we can do to intervene to help that oxidative stress go down and to reduce it. There's no way to get rid of it. It is a natural part of our body. Anytime your body converts glucose into ATP, it creates free radicals, or they also are called reactive oxygen species. So this is just part of our life, but we need to make sure that we have plenty of antioxidants on board to manage them and to do everything in our power to reduce these free radicals, reduce this oxidative stress so that we don't end up causing damage to our arteries and to our DNA and to our brain. So that was a super simplified explanation. Diana or Celeste or Gwen, does anyone have anything to add to that that makes it clearer? No? Okay. So the reason we're testing oxidative stress is to see where you're at, because there's no way. It's not like a symptom. You're like, oh, I have a headache, I must have some oxidative stress today. It's not going to show up in an obvious way like that. Certainly from your history, right? If you come and you're sharing your health story with me and you tell me that you barely sleep and you've had chronic stress for years and you eat a diet that includes a lot of fast food or a lot of sugar, like, I'm going to know you've got some excess oxidative stress in your body. But we don't necessarily know if it's causing that damage yet or where it's causing that damage. And even those of you who have really healthy diets, who get great sleep, who exercise really well, there's environmental pollutants. There's things in our life that can cause oxidative stress that we have less control over. Or maybe we don't even know that we need to be cleaning out our houses and our beauty cabinets of these things that are causing problems. So I really wanted us to measure the oxidative stress in your body so that we know whether or not we need to be aggressive with interventions, or if we need to do a deep dive to see where this oxidative stress might be coming from. And the interventions would both be two-sided, right? It would be reducing that oxidative stress from all those different causes, helping you exercise, get better sleep, reducing your chronic stress, improving your diet, making sure that you have lots of antioxidants on board, possibly supplementation. And on the other side, intervening in places where that oxidative stress already exists. So reducing your cardiovascular risk, improving your, all the things that improve cognitive health and brain health. So the tests that we do, like we said, we do ox-LDL, and that is looking at your LDL particles, which is your low density lipoproteins. You guys probably know it as the bad cholesterol, which is a misnomer, but either way, it is the lipoprotein that takes cholesterol out into your body. And if this LDL particle gets oxidized, meaning all these causes that we just talked about can damage this LDL particle, that particle can then get into your endothelium, into your arteries. So you have an artery, it's like a tube, and then you have a lining of that tube. What happens when the LDL gets oxidized, it gets underneath that lining of the tube in your endothelium. And then it causes an inflammatory response, which is, again, one of those things in our body that is circular, right? Inflammation causes oxidative stress, and then that oxidated LDL molecule gets into your arteries and causes more inflammation. And when we have inflammation in our body, we have a response, right? Which is a really healthy response. You get an infection, your white blood cells, your neutrophils, your macrophages all rush to take care of it, to neutralize that threat. But when you have oxidized LDL that gets into your arteries, it creates that response, and the macrophages, which are basically inflammatory cells that eat infections, right? They eat things, or they're like Pac-Mans, they eat things up. So it gets, those macrophages come, they go under their arterial layer to get to this threat, which is the oxidized LDL, and starts eating it. But it's trapped in that endothelium and it can't get out. So more and more macrophages come, more and more inflammation starts, and they turn into something called foam cells, meaning they eat so much of the oxidized LDL and they get trapped there that they get big and foamy, and then slowly but surely they turn into calcified plaques. And if you think of an artery as a tube, as a lumen, if you start building out from that with plaques, calcified plaques, it lessens how much fluid can go through that artery at the same speed. So if you think of a straw, if you have a big straw, you can get fluid through really quickly, but as that straw gets thinner and thinner, that water goes through less quickly. It can, and if you're looking at your artery, that can cause higher blood pressure, and it can cause rigidity. So one of the ways that our body manages our blood flow and our blood pressure is those arteries are really flexible and they respond to lots of different things in our body. So for instance, if you're laying down and you stand up, your arteries are supposed to move in a way that helps keep your blood pressure stable. And when you have constriction there, if you have rigidity there, it can't do its job properly. And then there's the physical risk of the plaque. So you have calcifications building up. If you have blood pressure that's changing, you have blood that is pushing harder against this area, or if you have labile blood pressure that's changing a lot, those plaques can break off and cause occlusions or blockages. And that is where you get a heart attack, or that's where you can have a stroke. And so, you know, we throw around terms like oxidative stress, like it's like no big deal, but really we want to know if that LDL is being oxidized, if it's putting us at risk for atherosclerotic disease, putting us at risk for heart attacks and strokes. That's a really big deal. And so this one simple blood test is just showing us how much of your LDL is oxidized, how much of a risk does it pose? And that we look at in conjunction with your ApoB, which is a highly atherosclerotic molecule, with your total amount of LDL, with your protective HDL, and potentially, you know, where your triglycerides, are they high or low? Are they protective or harmful? And Lp(a), which is a hereditary marker that can pose risk for atherosclerosis. So looking at this all together gives us a really strong picture to know where we can intervene, what your risk is, and how to help you improve, right? It's easy enough to give you a list of 20 things, like, here, do all these things to make yourself healthier. But if we know where the risk is and what extent that risk exists, we can really give you more targeted information and interventions to do. So it was a really complicated physiology lesson. Are there any questions? Diana, do you have anything to add to that?
No, the key is there, it all goes together. So that's where Lisa really comes into play to help understand all of these different advanced cardiovascular blood tests and understanding your health picture and how to focus on improvement.
Yeah, I think the whole picture is important, and your history, right? The fact that you're telling me your whole history, so I know where that oxidative stress may be coming from. Maybe historically you've had stuff going on, and you don't need to remember all that physiology, but but I think it's really important to me. I don't want to do anything that someone tells me to do unless I understand why. So for me, if I'm about to if I'm craving something high in sugar, for instance, because that's my downfall, right? I'm craving something higher in sugar. Like I might think about like, ooh, my LDL ox was high, my LDL's high. I picture those free radicals bouncing around causing damage, and I can be like, maybe I'll go ahead and make myself that stir fry with all these healthy vegetables I have in the crisper instead. So I feel like it really drives motivation and helps us make decisions, right? Every time we're at this point where we're making a decision, do I want to do that thing or that thing? Am I going closer to my goals or further away from my goals? What have I learned about my own body to help me make this decision right now? So hopefully that will be helpful. Just understanding what's going on. And when you get your LDL ox numbers, again, we'll put it in a whole picture for you. It'll help you make some decisions for yourself and understand where to focus your efforts, because we can't do everything all at once. For those of you who are very recently new patients, you've already gotten that done, but a lot of you haven't gotten that test done yet, and we will be adding that to our 6-month follow-up for everyone who hasn't gotten it done yet. Okay, so I wanted to go on to the next oxidative stress test. It's called the OX 2.0. It's by Genova, which is the same company that does our GIFX test. It's a really well-respected company. And this test looks at 3 different things. It looks at our lipid peroxidases, which is oxidative stress of our lipids in our body, other fat other than LDL. And then it looks at the O8HDG. That's a very long word that I can't say, but that's what we call it. And that's looking at oxidative stress to our DNA. And both of these are found as metabolites in urine. And then finally, this test looks at our levels of glutathione, which is often called the master or the most important antioxidant in our body. It's very active in our liver, which is our organ that does the, that does reduce the oxidative stress in our body, reduces inflammation. And the glutathione level is just really important to let us know if we need to intervene with supplements, if we need to really increase your food intake of antioxidants. It also can let us see another level of how high the oxidative stress is, because if we're utilizing too much of our glutathione, it can stay low. So it's just another part of this well-rounded look at oxidative stress and to help us guide where to intervene and how. So that one's a really simple test. That one, everyone's going to get at their initial appointment. Anyone who starts from now on will get it at their initial appointment, along with the blood test and with the GIFX tool test. Those of you who have not gotten this test yet, which is most of you, we will be doing this test again at the 6-month mark. Any questions about that test?
Lisa, you said that was a urine test?
Yes, it's a really easy urine test to do at home. Okay. All right, if no one has any questions about that, I'm going to go on to the other test. This one isn't part of FLI because not everyone will need this test, and not everyone will want to do this test. This one takes a lot more understanding about why you would want to do the test, risks and benefits of it, and what you might find out from it, and your family history, your own level of comfort, your own fear of cancer, all come to play in whether or not this test is something that we would recommend to you. So it will be a real conversation between me and you about whether or not this test is the right choice. And it's obviously ultimately your decision, always, like every single thing that we do in healthcare is your choice. But I will be able to help guide you and ask you questions and figure out if this is something that's right. So this is called a Galleri test, Galleri. And it is a test that can look at very early detection of cancer that might exist in your body. So some people are already like, nope, I don't want that test. It sounds scary. And other people's like, oh my gosh, I can find early detection of cancer. That's amazing. So there's probably a lot of emotional pull with this test. And I had a lot myself when I was learning about it. And I went into learning about this test really skeptical. I thought the technology was almost too good to be true. And then when I heard some of the numbers, I was like, oh, it's not even worthwhile doing the overall numbers. However, I did learn, along with Celeste and Diana, we were on a call with one of the reps from the company, one of the medical providers who works for them. And we did a deep dive into this test. And I was really impressed with the technology, how they use it, how they report it, and what this can mean for people who do have a big family history of cancer, especially of multiple cancers, and especially of cancers for which we do not have good testing methods right now. So as you know, we have mammograms, we have pap smears, and those are really great indicators of tests, right? That's early detection, often of, breast cancer and cervical cancer. And so, we can feel really confident if we're getting our regular mammos and paps that we're going to catch that early. But there are other cancers, such as liver cancer or pancreatic cancer, that are really dangerous cancers that tend to have a hereditary component to it, but not always. And we do not have any good detection tests for them right now. And so for things like that, having a test where we could potentially detect it really early, when early detection really can result in treatment and survival, I think that's really exciting. So you guys probably have all heard of prenatal testing, where they can do this non-invasive testing with your blood if you're a pregnant woman, to look at potential issues for your child. They took that technology and applied it here. And it's a blood test. You can get your blood drawn at Quest or with us at FLI. And they look at your blood and they actually can locate, based on DNA of your cells, of if there are active cancer lesions in your body, active cancer in your body. It can look at these cells and say, there is this percentage of chance that there is a cancer in your body. Now, as you can imagine, that can lead to, anxiety, waiting for these results or thinking about them. So let me tell you the numbers and how this works. So they do the blood test, they do their detection method, which is a really interesting technology, which is beyond my understanding. Like they showed us how that technology works. And they can tell us with 99.5% specificity whether or not there is a cell that they found that is related to cancer. And that means out of 200 people who do this Gallery test, who take the blood test, one person will have a false positive. So if they do this test on 200 people, if they say that that they found something that could be an early detection of cancer, there's only a 1 in 200 chance that that's a false positive. So that is a really, really high number of specificity. Now, sensitivity, which is how many false negatives there will be when you do a certain test. Those are the two ways we look at how kind of effective a test is and how useful it is. So sensitivity, how many false negatives? So if you look at all of their screenings, and they test for many different types of cancer, in all of these screenings, they will have an overall sensitivity rate of about 50%, which is horrendous, right? It's basically a flip of a coin. However, for a group of cancers, specific kinds of cancers, they can tell us with much higher specificity or sensitivity. So whoever's in charge of this right now, can I go ahead and share my screen to show you this slide? Is that okay? I'm going to try.
Yep.
Can you guys see that slide?
Yes.
Excellent. So it's kind of small, I'm sorry, but you can see here, these are many of the different cancers that the Gallery test tests for. And I'm having to go close just to read it myself. So kind of down here with thyroid, it's 0% sensitivity, meaning they cannot detect with any certainty whether or not someone has thyroid cancer. And then you can see here, like breast cancer has a 30% sensitivity, also not very impressive, but we have breast cancer screening that is really effective in mammograms and MRIs and ultrasounds. And then if you go up, each line that goes up, the darker the blue and the higher the line, that is the more sensitive that this Gallery test is. So if you look up here, there are liver or bile duct cancer, 93.5% sensitive, which means that there's only going to be a 6.5% chance that if this test tells you that you have a liver, that they think that there's a liver cancer, that there's a very small chance that that is a false negative. So it can detect this very well. The other cancers it can detect very well are esophageal, head and neck, multiple primaries, pancreas, ovaries. And if you have a family history of ovarian cancer, you know that there are 0 current detections tests out there right now. There's no way to detect it. There's something called a CA-125, which is a really general screening test that can be done. It often doesn't show positive until things are really late, and it's general. It doesn't tell you where that cancer is coming from at all. And, you know, gynecologists will do it by manual and feel your ovaries to see if there's masses. Well, by the time you feel a mass, you're already in really late stage. Symptoms of ovarian cancer are very vague. Many of you probably have these symptoms: bloating, feeling full after you're eating, right? These are symptoms that can happen just because your microbiome isn't healthy. So having a test that can potentially catch an ovarian cancer early and enable you to get treatment, that can be life-saving for a lot of people. We also have colon and rectum cancer. Yes, we have colonoscopies, we have FIT tests, which give a good, which give us pretty good detection of these cancers early, but this would be another layer of that. Anus cancer, urolithial tract, cervical cancer, lung cancer, which we don't have very many good screening signs for. And by the time there's symptoms, it's already really late. So, and it goes down from there. So it's not perfect. It's not that if they do this test, you're 100% going to know if you have cancer. I'm going to stop sharing right now.
And we'll make sure to post this table in the Kajabi file along with the video so that people can
Yeah. So if we're looking at this test to try to figure out what's going on, most people who do this test are going to have a negative result, right? Most people don't have cancer in their body. So if you do this test and it comes back negative, it is telling you that right now they do not detect any cancer in your body. And again, remember that depending on the type of cancer, that will be more or less meaningful. And also, if you, sorry, I want to say something. I'm trying to think of the right wording.
While you're saying that, you know, so one, I really appreciate I've had this test done when I went to Peter Attia's clinic, and it was like, I did not get this comprehensive of a understanding of it. So I'm learning. Thank you. Appreciate the transparency around it. Is there a recommendation around the age at which you should first do this?
I don't remember if there was. I would imagine it would be around 50, but Diana, do you have another?
That's what, yeah, for Grail, they said start at the age of 50. And to be very clear, none of this replaces current USPSTF guidelines for cancer screenings. So you still need your mammogram, you still need your Pap, you still need your colorectal cancer screening, because those currently established tests have really high sensitivity. And how do you actually explain sensitivity? So sensitivity is really important for screening tools because we don't want to miss it. So a screening tool is going to over-diagnose because then there's diagnostic tools to actually confirm the diagnosis. So that's why the sensitivity of these tests matter, because we don't really care too much about the things that have sensitivity lower than 80%. A Pap has about a sensitivity of 80%. A mammo is closer to 87, and a colonoscopy is higher, closer to 90.
Yeah, that's all really important. Okay, so I wanted to describe a little bit about this. So most people who do this test are going to have a negative result. If you have a positive, they're saying that they have detected something that could be cancer in your body. And it's not telling you about your risk for cancer, right? It's not a genetic screening. It's not telling you, oh, we did this test, you're negative, you're good, you're not going to get cancer, right? It's telling you right now what is actually in your body. So if you embark on this screening and it's something that you think is important to do based on your history, it is something that the GRAIL recommends doing every 1 to 2 years, because that's about how quickly a cancer is going to grow from one stage to the next. So if you do one now and you're negative, it has no bearing on whether or not you can potentially have cancer in the future. So they do recommend getting it done 1 to 2 years so that you can see where you're at each time. And then I want to go into really what this test looks like when you're doing it and what it means and how to think about it, because it's very nuanced. And I feel like getting a test like this done without understanding this can add anxiety as opposed to help. And we definitely don't want to do that. So if you get this test done, like I said, most people are going to be negative. If it's positive, remember there's 1 in 200 chance that it's a false positive. So if it's positive, what Gallery does is they give you 1 or 2 likely points of origin. So they're not just going to say you may have cancer. They're going to say you may have cancer and it could be either ovarian or liver. If one of their points of origin shows that it's more than 90% likely to be from one single point of origin, let's say they do the test and they find that it's 95% likely to be the point of origin in your liver, they're going to just give you that one. And they're going to say, most likely, this is where this is coming from. And what they do, which I really love, is they give a complete workup of what to do based on what they found. Meaning, if there's potential for liver cancer, there's going to be liver tests to be done and ultrasounds. I don't know how each cancer thing is worked up. That is not my specialty. But if it's an ovarian cancer, it's probably going to be an ultrasound of your ovaries and maybe some other tests. So they're going to give very specific instructions to bring to your doctor or to us for the workup. And if that workup is positive and they find something, you know that you caught it as early as possible because you did this test, right? A lot of times they're catching things way earlier than they would if you didn't do this test and you were just waiting until symptoms arose. And if it's positive and they do the workup and they find it's positive, you're in care and you're getting the care you need. If they do the workup, let's say they think this is from your liver as the point of origin, and you go to the doctor and they do the full workup and they say, nope, we didn't find anything. There are 3 possible reasons for that, right? So you do the test, it says you might have cancer, this is where we think it's coming from, you go do your workup, and the doctor says, no, we did not find any cancer. It can mean one of 3 things. The first is you're 1 in 200, right? It's a false positive. The second thing it can be is incorrect origin, meaning they did find something that's cancer, but it wasn't actually from the liver where they predicted. And the third possible thing is that it's actually too early for the more traditional ways of vetting it, too early for them to pick up. So this is where I feel like it's really important to know yourself and to know how you would react to something like this. Because when this happens, if what they offer is a free follow-up Gallery test in 3 to 6 months, and if it comes back negative that time, then they can say, okay, we can assume that was a false positive. You don't have anything, and you can rest easy and do the test again in a year to check. And if they redo the test and it is positive, more likely, because more time has elapsed, they'll do a better job of figuring out where that point of origin is. And it might point to a different point of origin. And then you would go through the whole process of getting a workup again. Or it might be that it finds the same thing and the same point of origin, and then you'll go back and do a workup in case it was too early to find initially. So think about that amount of time, 3 to 6 months, where you might not have a direct answer. And so that's where kind of the psychology comes in of knowing yourself, of whether or not the potential of catching a cancer early outweighs the kind of ambiguity and possible anxiety you might have of not knowing what's going on for those months while you wait for this retest or the workup. So there are risks and benefits here. It is not a clear cut, yes, you should absolutely do this or not do this. You have to know yourself. And this was the same thing when I did prenatal care, when I was talking to people about genetic testing, right? If they're over 35, we recommended advanced genetic testing, and some people just didn't want to know. And they just didn't feel like they could, survive their pregnancy with that. So I feel like it's just really important to have a very in-depth conversation to really recognize where you're at and what you want. I think for people who have a family history of a lot of different cancers, especially those ones where there's a really high sensitivity and you're already worried about those cancers and there's no good screening tools out there, this might be a really excellent test for you to get, understanding that there could potentially be some period of ambiguity. So that's generally it. Diana and Celeste, you were both on that call. If you have anything else to add, I want to make sure that people are really understanding this test.
I think you did an amazing job, like going through the details, and I still learn from you. I think, to be honest, you did a much better job of just being so straightforward with the information. So thank you for, clarifying that in such a simple and easy way to understand. And I just wanted to highlight what Diana mentioned, that this doesn't, replace your regular screenings, and then also highlight that there are some cancers like the thyroid cancer. If that's something that you're concerned about, then this is not the right test for you.
Right. And again, we'll publish that. So what is the right way for them to order it? We have a package in Healthy. So people can go into your Healthy portal if you want to purchase the test. It's $1,200, $500 for the test. And like Lisa said, we can do the blood draw for you, or you can get that done at a Quest lab.
Yeah. And it's not a fasting lab, so you can come in the afternoon. And I would really encourage you, unless you're 100% sure after this talk, to like, yes, I want this. If you have any questions, talk to me first before you go ahead and order that test. Let's just make sure this is the right test for you before you go ahead and pay that money. And if you're 100% sure after hearing this, go ahead and do that. And then the way you book your appointment to do the blood draw with us, if that's what you prefer, you just write to appointments@flymd.com to talk to Annie, and she'll book you an appointment to come get that blood draw.
And you could also decide to do it at the same time as your 6 months lab, as an example.
Absolutely.
So that you would need to draw. I think I recall from doing this test myself that it was maybe 5 tubes. It's not a small number.
I would probably recommend not doing it at the same time as another blood draw, because we already do draw a lot of blood.
Yeah, I did all mine together, and I didn't have an issue with it. But I think it's also, personal response to that. But I do think it is. Do you remember? Did they give you the specifics of how many vials?
I don't remember.
I believe it was. I believe it was. We can follow up with that too. But I'm pretty sure I recall it being like 3 to 5.
Okay. Diana, I would love to hear any other thoughts you have, or anything you feel like would give people more information that they need to make this decision.
Well, I think that my sort of viewpoint and role here is always to make sure that everybody understands the full picture. And I think the utility of doing it through FLI is that you're not just getting a bunch of information and not knowing what to do with it. And so we've thought a lot about what results from the test actually matter and what don't. So for the tests that have low sensitivity, sort of just ignore those. And Lisa is able to help you sift through which results matter and which don't. And it's the informed decision making for you all to know is, if something has a low sensitivity, it's not a good test to reassure you about anything. It's sort of something to ignore. And it's really to focus on those tests that have high sensitivity. And then the other bit is early multi-cancer detection tests like these require annual draws for it to have good lifelong predictability. I'm not saying that as a salesperson. I'm saying that as, when we look at cancer screening that is mainstream, you have to do it at the cadence at which they are meant to be done. If you're not doing it at that cadence, it's not really reducing your lifetime risk of having that cancer and complications from that cancer. So it's not a one and done test. If it's something that you want to take sort of seriously in terms of your long-term health and longevity, it's something that is meant to be done annually in the way that you get your mammogram at a certain cadence, your colon cancer screening, as well as cervical cancer screening. So that's all I think really important to know as you're thinking about it. But I think the huge, huge value add here is having that individualized thought process ahead of time, as well as interpretation of the results for you as an individual.
So that was my content for today. It's a lot of
Lisa,
science.
I have a question.
Yeah,
Sorry about the video off. I'm like trying
no
to
problem.
be on a work call and listen at the same time. Given this is a newish test, what do you all know about how, let's say I have the test and then I need to sort of go in and advocate for myself beyond FLI to like get some testing done? Like, how are your sort of traditional medical establishment, like, how are they responding to it? If I walk in and I'm like, hey, I got this test done, are they going to be like, oh, great, we know about this test? Yes. Or is it still new enough where there might be some surprise or pushback if you're in like a Sutter or you know what I mean?
Yeah, that's a really, really good question. I'm going to let Diana field that.
I asked the same question, right? Like being at the forefront of health technology is great and exciting, but knowing what to actually do with it matters. And sort of the big level answers are UCSF Health is actually making a clinic for people who get these outside testing done to refer patients to when there's a positive screening test. So I think that's probably the obvious and most promising thing. But the other thing that Grail mentioned is that there are providers in each of the major networks in the Bay Area that are familiar with the Gallery test. So I think if there is any level of pushback, we can easily go to, before you get referred to someone, we can chat with Grail for your specific health system to see who they've worked with, so that the person that you're going to go see is familiar with it and not just dismissing this test as not mattering.
Great, super helpful, thank you.
Any other questions?
I have a thought and it may be a question. You mentioned, like, obviously we're not going to tell people what to do, and this ultimately is their choice. But for the member who is, thinking about taking this test, and you mentioned like family history, but what other, potential reasons or things should the member be thinking about? Like when they're like, should I take this test? Should I not? Is there anything that stands out in your mind as a provider when you're maybe suggesting as this test as an option?
Yeah, I mean, I think if you know that you grew up near like an industrial plant or some like really high exposure area, that could be something to consider. Your own personal fears about cancer, right? Like if this is something that is on your mind, as you don't want to have cancer and you want to catch it as early as possible and you want to treat it as early as possible. And we know that cancer is unfortunately more and more prevalent for most types of cancer, not all. I think this is something that could be reassuring to you as long as you're able to do it every year. And then of course, family history is a big one, especially for those cancers that tend to be hereditary. Diana, do you have an answer for that?
Yeah, I think these multi-cancer early detection tests are going to become the norm in the next few years. There's a lot of progress being made. And if you talk to people in oncology, like they're all very excited about this. So if you're okay with doing something that isn't necessarily, in 5 years is going to be really mainstream and probably better somewhat, but if you're open to trying something earlier on that's still solid, we're just trying to figure out how to utilize it better, I think it makes total sense. Who would I say to think extra careful? If you have a lot of health anxiety and sort of have trouble living in the in-between space, I think that may confer sort of a significant conversation to have with Lisa before you decide whether or not to do something like this.
Yeah, I really agree. I think that's not to be underestimated, which is why we didn't come on here and say, hey, we're adding this on. Let's everyone do this. Like, I think there's real thought that you need to have about who you are and how you manage things. And honestly, if you've used like a CGM and a sleep tracker and have found them interesting and curious and you haven't had any stress with them, that's a good indicator that you might, you know, be more open to data and not have it affect you. Whereas if you're someone, and we have had people in FLI who just got so anxious with a CGM that they couldn't keep it in anymore because even just that day-to-day data was really stressful for them. Like, that's an indication also of the type of health person you are. And we can absolutely have a conversation as long as you need to figure this out for you before you make the decision. Any other questions? Did you guys want me to cover anything else? That was what I planned for today. I thought there'd be a lot of questions about Gallery.
You were so thorough. You hit everything. Let's see if there are any lingering questions.
I'm gonna look in the chat to see if there's anything. Nope.
I don't see anything either.
All right. Well, you guys, we're here. If you have any questions, if you want more information, there's a lot of science on this one. So if you're like, what was that about oxidative stress? Again, don't worry. When we get your test results back, I will explain it again, especially in context of your own history and your own other labs. So we will see you guys soon. Thank you for being here.
Yes, next week we have Dr. Gersh, and it's in the it's on Wednesday evening, not Thursday, since Thursday is Halloween. So we have her at 7 p.m. on Wednesday.
Yes. Oh, one more thing, you guys, really important. If you're on this call, we have a retreat coming up on December 6th. It is going to be incredible. It is going to be, there's going to be breathing. There's going to be, you know, working on past traumas. It's going to be a connection event, and there's only room for 15 people. So please, if you can be there, if you can block that out in your calendar, please RSVP and let us know that you want to go so we can save your space.
Perfect.
All
Thanks,
right.
guys.
Take care,
All right,
everyone.
everybody. Have a great day.